Imagine uncovering the hidden risks behind some of the most commonly prescribed medications, drugs that even doctors hesitate to use long term. These medications, often crucial in certain situations, come with potential side effects that medical professionals would rather avoid if possible. Today, we're diving into 5 such medications, explaining why extended use can sometimes do more harm than good, the science behind these concerns, and healthier kind, root cause focused alternatives. Each of these medications serves a purpose. They alleviate pain, lower cholesterol, promote sleep, manage blood sugar, or control acid reflux. However, prolonged use of these drugs may lead to issues like increased cardiovascular risks, dependency, organ damage, and nutrient deficiencies, serious effects that can often go unnoticed until symptoms arise. It's vital to understand not only what these drugs do, but also the potential long-term consequences and lifestyle adjustments that can serve as safer, sustainable alternatives. Let's take a closer look at why doctors are cautious and explore empowering, health-boosting options beyond medication. 1. Painkillers. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, including popular medications like ibuprofen, diclofenac, and naproxen, are among the most commonly used pain relievers worldwide, with over 30 million Americans using them daily. These drugs are effective for temporary relief of pain and inflammation, yet their long-term use is linked to substantial health risks. Cardiovascular risks. A comprehensive meta-analysis from the European Heart Journal reveals that long-term NSAID use can increase the risk of heart attack or stroke by 20 to 50%, especially in high doses. Diclofenac, for instance, has been shown to elevate cardiovascular risk by up to 50%, making it one of the most concerning NSAIDs for heart health. This effect is due to how NSAIDs affect blood clotting, blood pressure, and kidney function, which can contribute to heart strain over time. Gastrointestinal and kidney risks. NSAIDs can damage the gastrointestinal GI tract, causing stomach ulcers and bleeding. A study in the American Journal of Medicine estimates that over 100,000 hospitalizations annually are linked to NSAID-related GI complications in the U.S. alone. These drugs also affect the kidneys as they reduce blood flow to these organs. A study in the New England Journal of Medicine found that prolonged NSAID use increases the risk of chronic kidney disease by 32%, a concern for those already vulnerable to kidney issues. Alternatives to NSAIDs. While NSAIDs are invaluable for short-term pain management, they don't address the root causes of chronic pain. Doctors suggest exploring healthier, more sustainable alternatives. Physical therapy and low-impact exercise. Regular, guided movement can improve joint function and reduce stiffness, especially for conditions like arthritis. Natural anti-inflammatory foods. Foods like ginger, turmeric, fatty fish, and leafy greens contain compounds that help reduce inflammation naturally. Studies have shown that curcumin from turmeric and omega-3 fatty acids from fish can significantly lower inflammation markers in the body. Acupuncture. Research from the Archives of Internal Medicine shows that acupuncture is effective for managing chronic pain, providing a 50% improvement in symptoms for some patients. Responsible NSAID use. For those who need NSAIDs, doctors recommend using the lowest effective dose for the shortest duration. Some physicians also advise taking NSAIDs with a stomach protective medication, like a proton pump inhibitor, to reduce GI risks. However, regular consultation with a healthcare provider is critical, especially if NSAIDs are taken for more than a few weeks. By balancing NSAID use with natural and lifestyle approaches to pain management, individuals can manage pain effectively while minimizing the long-term risks associated with these powerful but potentially harmful medications. Number 2. Statins, cholesterol-lowering drugs. Statins, including atorvastatin, simvastatin, and rosuvastatin, are widely prescribed for their proven ability to lower cholesterol, reducing cardiovascular events by 25 to 30% for those at high risk, according to studies published in The Lancet. They work by inhibiting an enzyme involved in cholesterol production, effectively lowering LDL cholesterol, bad cholesterol levels in the blood. Statins are particularly beneficial for patients with prior heart attacks or those with high overall cardiovascular risk due to conditions like hypertension or diabetes. However, for individuals whose primary concern is high cholesterol without other risk factors, statins may not always be the optimal first-line approach. Side effects and long-term risks. While statins are effective, they come with potential side effects, particularly with long-term use. Muscle pain and fatigue. Statin-associated muscle symptoms, SAMS, are the most common complaint, affecting up to 20% of users. Muscle pain, weakness, and fatigue can interfere with daily activities and adherence to treatment. Cognitive issues. Some patients report memory lapses, confusion, and brain fog. Although research is ongoing, a study in the Journal of the American Medical Association highlighted that statin use in some individuals was associated with mild cognitive impairment, though these effects are often reversible once statins are discontinued. Increased risk of type 2 diabetes. Studies show that long-term statin use can increase the risk of developing type 2 diabetes by as much as 50%, especially in individuals with other diabetes risk factors. Statins may raise blood sugar levels by affecting insulin sensitivity. Alternatives to statins for managing cholesterol. For individuals with only mildly elevated cholesterol, lifestyle adjustments can often achieve significant improvements without medication. Dietary changes. Adopting a diet low in saturated fats and high in fiber-rich foods like fruits, vegetables, whole grains, and legumes can reduce LDL cholesterol. The American Heart Association reports that increasing soluble fiber found in oats, beans, and flax seeds can lower LDL by up to 10%. Regular exercise. Engaging in moderate exercise for at least 150 minutes per week can increase HDL, good cholesterol, and help manage LDL. A study in Circulation demonstrated that aerobic exercise can reduce LDL levels by as much as 10% in some individuals. Stress management. Chronic stress is linked to higher cholesterol levels. Practicing stress-reducing techniques like mindfulness, yoga, or deep breathing exercises can indirectly support healthier cholesterol levels. Responsible statin use and consultation. For those who require statins due to elevated cardiovascular risk, the benefits often outweigh the potential downsides. However, it's essential to monitor for side effects, as some patients may benefit from dose adjustments or alternative medications. Combining statins with a healthy lifestyle can also reduce reliance on higher doses, potentially minimizing side effects. By consulting with a healthcare provider and making targeted lifestyle changes, individuals can often improve cholesterol levels naturally or complement statin therapy with healthier habits, potentially reducing the need for lifelong medication. 3. Sleep medications. Zolpidem and other hypnotics. Sleep medications like zolpidem, Ambien, esopacolone, Lunesta, and Zaloplan Sonata are commonly prescribed for short-term relief from insomnia. These hypnotics work by enhancing the effect of gamma-aminobutyric acid, GABA, a neurotransmitter that promotes relaxation and sleep. While effective, these medications are not intended for prolonged use due to the significant risks that can accompany long-term reliance. Risks of chronic use. Dependence and tolerance. The body can quickly develop a tolerance to sleep medications, requiring higher doses to achieve the same effect. Over time, this can lead to physical and psychological dependence, making it difficult for users to sleep without the medication. Memory issues and cognitive side effects. Long-term use of hypnotics has been linked to memory impairment and cognitive issues. Studies, including one published in Sleep Medicine Reviews, show that prolonged zolpidem use can affect short-term memory and may even increase the risk of cognitive decline in older adults. Increased fall risk and motor impairment. Hypnotic medications can cause drowsiness, dizziness, and impaired motor coordination, increasing the risk of falls, particularly in the elderly. According to the Journal of the American Geriatric Society, long-term users of sleep medications have a 50% increased risk of falls and fractures. Parasomnias. Medications like zolpidem can sometimes trigger unusual behaviors during sleep, such as sleepwalking, sleep driving, and engaging in activities without full awareness. These behaviors can be hazardous, leading to unintentional injuries. The Rebound Insomnia Challenge. One of the main challenges with discontinuing sleep medications is rebound insomnia. This phenomenon causes insomnia symptoms to worsen temporarily after stopping the drug, often resulting in a frustrating cycle of medication use. Studies from the American Academy of Sleep Medicine suggest that withdrawal from zolpidem can cause a temporary spike in sleeplessness, making it harder for individuals to stop taking the medication. Alternatives for sustainable sleep improvement. Many non-pharmacological approaches can help promote restful sleep without the downsides of long-term medication. Sleep hygiene practices. Simple routines like avoiding screens before bedtime, creating a calming sleep environment, and keeping a consistent sleep schedule are powerful tools for improving sleep quality. Dim lights and avoid caffeine or heavy meals in the evening to reinforce your body's natural sleep cues. Cognitive behavioral therapy for insomnia, CBTI. This is a highly effective, evidence-based therapy that addresses underlying thoughts and behaviors that interfere with sleep. A meta-analysis published in JAMA Internal Medicine found that CBTI significantly improved sleep in chronic insomnia patients, often with results comparable to sleep medications. Natural sleep aids, supplements like melatonin, magnesium, and valerian root can sometimes help regulate sleep patterns and relax the body. However, it's important to consult with a healthcare professional to determine the safest approach. Finding a balanced approach to sleep. For those needing medication to address severe short-term insomnia, using sleep aids under medical supervision for a brief period can be beneficial. However, exploring non-pharmacological methods for lasting sleep improvements is ideal for long-term health. Through consistent sleep hygiene and mindful practices, many can establish sustainable sleep patterns that improve quality of life without the risks associated with long-term medication use. Number 4. Diabetes medications. SGLT2 inhibitors. SGLT2 inhibitors, such as canagliflozin, Invokana, dapagliflozin, Farxiga, and empagliflozin, Jardiance, are prescribed to help manage type 2 diabetes by lowering blood sugar. These medications work by blocking the sodium-glucose cotransporter 2, SGLT2, in the kidneys, prompting them to expel excess glucose through urine. While effective in controlling blood sugar levels, SGLT2 inhibitors carry specific risks, especially with long-term use. Potential risks of SGLT2 inhibitors. Urinary and genital infections. Since SGLT2 inhibitors increase the amount of sugar in the urine, they can create an environment that promotes bacterial and fungal growth, elevating the risk of urinary tract infections, UTIs, and genital yeast infections. Studies from the Journal of Clinical Endocrinology and Metabolism report that up to 10% of users experience such infections, with women at a higher risk. Dehydration and electrolyte imbalance. By promoting glucose loss through urine, SGLT2 inhibitors also increase fluid loss. This can lead to dehydration, low blood pressure, and electrolyte imbalances, causing symptoms like dizziness, fatigue, and weakness. Elderly patients, in particular, are more vulnerable to dehydration and should monitor their fluid intake closely while on these medications. Diabetic ketoacidosis, DKA. In rare cases, SGLT2 inhibitors can lead to a potentially life-threatening complication called diabetic ketoacidosis, even in patients with type 2 diabetes, where DKA is typically less common. DKA occurs when the body produces excessive ketones, leading to symptoms such as nausea, vomiting, abdominal pain, confusion, and difficulty breathing. The American Diabetes Association emphasizes the importance of recognizing early warning signs, as untreated DKA can result in coma or death. Increased risk of amputation. Some studies, including research published in the New England Journal of Medicine, have suggested that canagliflozin might increase the risk of amputations, particularly of toes and feet, in patients with peripheral artery disease or diabetic neuropathy. While this risk remains under investigation, it underscores the importance of regular foot checks for those using SGLT2 inhibitors. Lifestyle alternatives and first-line medications. For managing type 2 diabetes, lifestyle changes can often make a significant impact on blood glucose levels and insulin sensitivity, potentially delaying or reducing the need for medication. Diet and exercise. A balanced diet rich in whole grains, vegetables, lean proteins, and healthy fats, paired with regular physical activity, can greatly improve insulin sensitivity and overall blood sugar control. Studies from The Lancet show that losing even 5 to 10% of body weight can significantly reduce blood glucose levels and improve health outcomes. Metformin as a first-line option. Metformin is typically the preferred initial medication for type 2 diabetes, as it effectively lowers blood sugar without the risk of severe side effects associated with SGLT2 inhibitors. It also helps improve insulin sensitivity and has been shown to reduce cardiovascular complications in diabetic patients. Monitoring and safe use of SGLT2 inhibitors. For those who need SGLT2 inhibitors due to other cardiovascular or kidney benefits, regular monitoring is essential. Stay hydrated. To avoid dehydration, patients are encouraged to drink plenty of water, especially during warmer weather or after physical activity. Regular checkups, routine blood work to monitor kidney function, as well as regular foot and skin checks, can help identify potential side effects early on. Report symptoms promptly. If signs of DKA, infections, or dehydration occur, prompt communication with a healthcare provider is vital to prevent complications. While SGLT2 inhibitors can be beneficial, their use requires caution. For many, adopting lifestyle modifications and consulting with a healthcare provider about alternatives like metformin can provide effective diabetes management without the added risks associated with SGLT2 inhibitors. 5. Proton pump inhibitors, PPIs, acid reflux treatments. Proton pump inhibitors, PPIs, such as omeprazole, Prilosec, lansoprazole, Prevacid, and esomeprazole, Nexium, are widely prescribed to treat acid reflux, gastroesophageal reflux disease, GERD, and ulcers by reducing stomach acid production. While they are highly effective for short-term relief, prolonged PPI use can lead to a range of health complications. Risks associated with long-term PPI use. Vitamin B12 deficiency. Stomach acid is essential for absorbing certain nutrients, including vitamin B12. Studies from the Journal of the American Medical Association, JAMA, have shown that long-term PPI use can reduce B12 absorption, potentially leading to fatigue, nerve damage, and cognitive decline in severe cases. Mineral deficiencies. PPIs can interfere with the body's ability to absorb calcium and magnesium, increasing the risk of osteoporosis and fractures, particularly in older adults. Research published in Osteoporosis International highlights that PPI users are at a higher risk of hip fractures due to impaired calcium absorption. Increased risk of infections. Stomach acid acts as a barrier against harmful bacteria, and reducing acid levels can make the body more susceptible to infections. Long-term PPI use has been associated with a higher risk of Clostridium difficile, C. diff, infections, which can cause severe diarrhea and, in extreme cases, be life-threatening. Potential for kidney disease. Emerging research from JAMA Internal Medicine suggests that extended PPI use may increase the risk of chronic kidney disease, CKD, and in some cases acute kidney injury. These risks highlight the importance of monitoring kidney function for long-term users. Natural and lifestyle-based alternatives for acid reflux. For many individuals, lifestyle changes can effectively manage mild to moderate acid reflux symptoms, reducing the need for prolonged medication. Dietary adjustments. Eating smaller, more frequent meals and avoiding trigger foods like caffeine, spicy foods, and acidic foods can significantly reduce acid reflux symptoms. Timing of meals. Avoiding meals close to bedtime and allowing at least 3 to 4 hours between eating and lying down helps prevent nighttime reflux. Weight management. Maintaining a healthy weight can reduce pressure on the stomach, lowering the likelihood of acid reflux. Regular water intake. Interestingly, studies show that drinking water regularly throughout the day can help flush out excess acid, providing relief for mild reflux without the need for medication. Safe use of PPIs. When PPIs are necessary, it's essential to use them safely to minimize risks. Lowest effective dose. Using the lowest dose that effectively manages symptoms and limiting the duration of use can help reduce the risks associated with PPIs. Gradual tapering. Sudden discontinuation can lead to rebound acid hypersecretion, where the stomach overproduces acid. Tapering off PPIs gradually, under a doctor's guidance, can help prevent this rebound effect. Consider H2 blockers as an alternative. For individuals who need occasional acid reduction, H2 blockers, such as famotidine, can be effective and may carry fewer long-term risks than PPIs. PPIs play an essential role in managing severe acid-related conditions, but long-term use should be carefully managed. Consulting with a healthcare provider about potential side effects, along with lifestyle modifications, can help many people control acid reflux symptoms naturally and reduce dependence on these medications. Conclusion: medications play a vital role in managing chronic conditions, but long-term use without addressing root causes can lead to significant health risks. Lifestyle adjustments, like healthy eating, regular exercise, stress management, and sleep hygiene, are powerful tools that can often reduce or eliminate the need for medications. If you need long-term medication, always consult your doctor to weigh the benefits and risks. Thank you for tuning in. Don't forget to like and subscribe for more insights on health and well-being.